before entering the room, I would verify the physician's order for extubation and also check the patient's chart for the appropriate FiO2 to put him on after the extubation. I would then gather my equipment. I have a yank hour hooked up to a suctioning source, which is set up at -120 to -150 millimeters of mercury. I have the ET tube, the ET holder, the closed suctioning system. I also have a large volume nebulizer set up on the wall with corrugated tubing hooked up to an aerosol mask. I will set that up to the appropriate FiO2 according to the patient's chart. I have a 10 cc syringe, pulse oximeter, my stethoscope. I also have an extra intubation tray on hand, which includes a Macintosh curved blade, the Miller straight blade, and the laryngoscope handle, the CO2 detector, the ambo bag with mask, an extra ET tube, a stylet, an ET holder, and an extra closed suctioning kit as well. Also, I have a small volume nebulizer set up with racemic epinephrine. So at this point, I would wash my hands and put on my gloves. I would then introduce myself to the patient. Hello, my name is Wayne. I'm from the respiratory department. I would verify his ID by checking the wristband for his first and last name and date of birth. I would then explain the procedure to him. Okay, Mr. Brown, I'm here to take out your ET tube, and once it's taken out, you'll be breathing on your own. I will verify that he understands what I just explained to him and ask him to squeeze my hand. At this point, I will assess the patient by using the pulse oximeter, which will tell me the patient's heart rate and also his oxygen level. I will also want to have the large volume nebulizer on at this time at 10 liters per minute. I will now put the patient into the high Fowler's position. I'll first use the yank hour to suction the patient along the ET tube on both sides. Then switch to the closed suctioning system. And this should take no longer than 15 seconds, which would be 10 seconds in and 5 seconds out. Okay, the ET tube is now suctioned. And switch back to the yank hour. Right now I want to loosen the ET holder. Also deflate the cup. Okay, Mr. Brown, on the count of 3, I'm going to have you cough, and then I will be removing your intubation tube. 1, 2, 3. I will set the ET tube on the chuck. I will have the patient cough one more time and remove any remaining secretions in the mouth. point, I will apply the large volume nebulizer that's set up to the appropriate FiO2. And I'll also assess the patient's breath sounds, checking specifically for stridor. If stridor is present, then the racemic epinephrine may have to be administered via the small volume nebulizer. If the stridor worsens, the patient may have to be re-intubated, which is why we have the extra intubation tray on hand. After assessing the patient and he seems to be stable, I'll then clean out my area and go to the patient's wash my hands, and then open up the patient's chart and document.